Hi, my name is Paul Tawana. I'm the current Francis J. Reichman Professor and Chairman of the Department of Oral and Maxillofacial Surgery here at the University of Oklahoma Health Sciences Center. The residents here practice and learn the full scope of the specialty, but they also have experience in some of the extended scope areas, such as craniofacial surgery and cosmetic surgery. In addition to that, there's still a fundamental focus on the traditional aspects of the residency experience, including dental-alveolar surgery, anesthesia, and implantology.
Within the state of Oklahoma, Oklahoma City has the only level 1 trauma center, so you're going to be getting a very good, robust training in maxillofacial trauma, as well as the different hospital systems that you will be exposed to are all within a reasonable mileage from one another.
The most common procedures that we perform in our clinic would be dental alveolar procedures such as wisdom tooth removal, extractions, and dental implants. But we also perform a variety of minor pathology procedures in our clinic as well. In our resident clinic, the residents do the vast majority of the surgery under close supervision by the faculty. This really allows them to get hands-on experience with procedures that they will be doing on a daily basis when they graduate.
Trainee can expect in the first year especially to have 6 months of anesthesia training where they will function as a first-year resident in anesthesia. They will run the room. Obviously, the anesthesiologist will be there to start the case and to finish the case, but through the whole case, they are the sole resident running the room. Also, during the first year, they will spend 2 months doing a medicine rotation, and the 4 months remaining, they will be in the clinic doing cases with other residents and attendings. On the second year, they devote 8 months of those 12 months for oral maxillofacial surgery training. They spend that time in our oral surgery clinic, doing all sorts of oral surgeries like teeth extractions and implants. They will rotate at the hospital as well on calls, just like the first years whenever they are in our clinic. For the remainder of that 12 months, for 4 months on the second year, they will be doing the general surgery rotation where they will be exposed to full body trauma with the general surgeons, ICU, and they learn a lot of medically compromised patients, how to handle those patients as well. The 2 last years are for what we call the upper level residents. Now they have trained the basics and they are ready for that maxillofacial training, and they're going to be exposed to full scope or maxillofacial surgery. They're going to be doing a lot of trauma cases, orthognathic, temporomandibular joint procedures, mandibular and maxillofacial reconstruction. So absolutely full scope, and I would consider this to be top 5 programs in the nation just because of the full scope that we are able to offer. The residents leave absolutely comfortable with handling core oral maxillofacial surgery, and on top of that we also do a lot of cleft and craniofacial procedures where they get exposure to advanced procedures.
So what interested me the most about the program here at OU is the broad scope of practice, the camaraderie amongst the residents, and the mentorship from the attendings. So outside of the program, here in Oklahoma City, I have a family at home with a little kid, and there's plenty of family-friendly things to do for kids all ages, and there's a lot of outdoor activities, so you can definitely stay busy here in Oklahoma City.
I think Oklahoma City as a training venue is incredible. I mean, we've got a low cost of living. The people are absolutely wonderful. You get integrated into the community very, very easily. I just think there's so many things that we've got as a city in general that really outstrip what a Dallas or a Houston or an LA or another big metropolitan area might have. I think everyone that comes here grows to love Oklahoma, and a lot of people come back. They come back to see it. They a lot of times make lifelong friends here. So I think from that standpoint, Oklahoma City stands out more so than other large cities around the country. And I think that helps our training program be close knit and be small but big at the same time.
Typical day, we start rounds around 6 a.m. at OU Main Hospital. Then 3 days a week, we may have, our Department of Corrections clinic where we see our new jaw fractures and follow-ups for our DOC trauma patients from 7 to 8 at the College of Dentistry clinic. Then starting at 8 is when our College of Dentistry clinic opens, and that's mostly ran by the lower levels. So mornings at the clinic here is all of our dental extractions, implants, sedations, all those things. Then we usually have a lunch break from 12 to 1. Then afternoon clinic starts at 1, where that's all of our post-ops, follow-ups, and then new patient consults and things like that. And occasionally we have one or two procedures in the afternoon, but that's a typical day for second year and first year residents. Then occasionally lower levels will do dental extraction cases over at the hospital for medically complex patients.
I think probably the most important thing that we have is a very diverse set of surgeons practicing very divergent sets of skills. This allows for the faculty to impart to our residents an outstanding clinical experience along with an excellent academic program.